The teeth, digestive system. Welcome. The teeth are embedded in the alveoli, or sockets of the alveolar ridges of the mandible and the maxilla. Babies are born with two sets, or dentitions, the temporary or deciduous teeth and the permanent teeth, at birth. The teeth of both dentitions are present in immature form. In the mandible and maxilla, humans typically have 4 types of teeth, each serving different functions. Incisors, in the bracket 8 in total, the sharp, flat teeth at the front of the mouth, they are used for cutting food into small pieces. Canines, in the bracket 4 in total, pointed teeth, next to the incisors. They are used for tearing food, especially meat. Premolars, in the bracket 8 in total, located behind the canines. Premolars have 2 cusps, in the bracket points. They are used for crushing and grinding food. Molars, in the bracket 12 in total, the large, flat teeth at the back of the mouth are used for grinding and crushing food. Wisdom teeth are the 3rd set of molars, typically emerging in early adulthood. A tooth is made up of several key parts. Crown, the visible part of the tooth above the gum line, covered by enamel. Enamel, the hard, outer layer of the crown. It is the hardest substance in the human body, protecting the tooth from decay. Dentin, the layer beneath the enamel. It is softer than enamel and makes up most of the tooth's structure. Dentin contains microscopic tubes that transmit sensations like heat, cold, and pressure. Pulp, the innermost part of the tooth, containing blood vessels and nerves. It is responsible for the tooth's vitality. Root, the part of the tooth embedded in the jawbone. It anchors the tooth in place. There are 20 temporary teeth, 10 in each jaw. They begin to erupt at about 6 months of age and should all be present by 24 months. Teeth shedding is the process where primary, in the bracket baby teeth, fall out to make room for permanent, in the bracket adult teeth. The shedding begins around the age of 6 and continues until the age of 12-13, when the last baby molars fall out. The permanent teeth begin to replace the deciduous teeth in the 6th year of age, and this dentition, or 2 sets consisting of 32 teeth, is usually complete by the 21st year. By age 21, the last set of molars in the bracket wisdom teeth may emerge, although not everyone develops wisdom teeth. The function of teeth. Chewing. Teeth break down food into smaller particles, making it easier for the body to digest and absorb nutrients. Speech. Teeth help in the articulation of sounds and words. Aesthetic or facial structure. Teeth contribute to the shape of the face and overall appearance, affecting the smile and facial symmetry. Dental care. Good oral hygiene is essential to maintain healthy teeth. This includes brushing. Teeth should be brushed at least twice a day with fluoride toothpaste to remove plaque and prevent tooth decay. Flossing. Daily flossing helps remove food particles and plaque between teeth that a toothbrush can't reach. Regular checkups. Visiting a dentist regularly helps detect and treat any dental issues early. Common dental problems include cavities in the bracket, tooth decay, caused by the buildup of plaque, which produces acids that erode tooth enamel. Gum disease in the bracket, periodontal disease, infections of the gums that can lead to tooth loss if untreated. There are two main stages. Gingivitis, the earliest stage, characterized by red swollen gums that may bleed when brushing or flossing. Periodontitis, a more severe form, where the infection spreads to the bone that supports the teeth, leading to tooth loss if untreated. Tooth sensitivity, pain or discomfort when teeth are exposed to hot, cold, or sweet substances, often due to enamel erosion or gum recession. Malocclusion, misalignment of the teeth and bite, which can lead to difficulty in chewing and speaking. Prevention tips. Brush teeth at least twice a day using fluoride toothpaste. Floss daily to remove food particles and plaque between teeth. Visit a dentist regularly for checkups and professional cleanings. Limit sugary foods and drinks that contribute to cavities. Avoid tobacco products and excessive alcohol consumption to reduce risks for gum disease and oral cancer. Drink plenty of water to help keep your mouth moist and reduce the risk of tooth decay. By maintaining good oral hygiene and seeking prompt treatment for any dental problems, most issues can be managed or prevented. Regular dental visits are key to ensuring long-term oral health. Thanks for watching. If you enjoyed the video, make sure to hit that thumbs up button. And don't forget to subscribe for more awesome content. Also, tap the bell so you never miss an update. See you next time.